Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. My guest this evening is Dr. Lawrence Green, President of the Montgomery County Medical Society. Dr. Green, welcome to Housecall.
Thank you, Dr. Doman. It's a pleasure to be here with you today.
Anyway, may I call you Larry?
Please, please.
So Larry, briefly tell our viewers about your professional background.
Well, I'm a board-certified dermatologist and Clinical Professor of Dermatology at George Washington University School of Medicine. But I am this year President of the Montgomery County Medical Society, and that's an organization I have really grown to love because it is something that advocates for not just us as physicians, but it advocates for our patients as well. And actually, I'll tell you, if that's okay, I can tell you a story. That's how I got involved in the County Medical Society probably 15 years ago. Because as a dermatologist, I noticed that there were many places in the state where technicians and unqualified people who didn't have any medical education were performing cosmetic medical procedures. They were practicing medicine, like giving botulinum toxin or doing lasers. And people were coming to my office, they were being hurt and sometimes burned or had their faces weren't really symmetric after this. So I wondered what I could do. And I spoke to my national organization. And my national organization really said to me, Dr. Green, the practice of medicine is on the state level. You have to work with your state. And they offered their support, but really the County Medical Society came to bat for me. Mm-hmm. I went to them, and they didn't know me from anybody. And I told them about the situation and what I saw happening. And they really took me under their wing. And they really helped me get regulations passed in Maryland. It took a few years. And Maryland is now one of the safest, most protected states for people in the country when it comes to cosmetic medical procedures. We have regulations in place that protect our people when we go, that you have to be a board-certified dermatologist or board-certified in this area of expertise of cosmetic medical procedures to perform lasers, and you have to have an RN at least under you doing the procedure. You have to be there all the time. You can't have shops in shopping malls doing botulinum toxin and cosmetic medical procedures.
Botulinum meaning Botox.
Yeah, that's right. A trade name. There are many other botulinum toxins.
But for our viewers' benefit.
Yes. Trade name Botox, like Kleenex these days. It's just a name. But it's safe. And in many other states, like across the border in Virginia, there are no regulations. So you can go to a mall and get Botox, botulinum toxin, by someone who just graduated high school, has no medical training. And we were very lucky in Maryland that we have a county medical society who helped me work with the state medical society to get regulations passed. So that's how I got involved. And I saw what the influence of the county medical society was and how it really came to bat, not just for the doctors, but to serve the people in the state of Maryland. And that's what I was impressed with.
Very good story to open the show.
Yeah, all true. Yeah. Very, and I'm very proud to be its president now. Because we want to continue to do things like that for physicians and for the people who we serve. Right.
Share with our viewers the difference then between the Montgomery County Medical Society, MedCai, also known as the Maryland State Medical Society, and the American Medical Association.
So that's a great question, and it all goes on levels. The County Medical Society, I think, is where it all starts because that's local. Now, I mentioned the practice of medicine is decided by states. So you have to go to the states to determine how medicine is practiced in your state. But we're local. The County Medical Society represents 1,500 physicians in our county. Mm-hmm. And these physicians are all people who are involved and want to advocate for their patients to make life better for us as doctors and how we see patients and for our patients themselves. In fact, I would encourage all the people listening to ask their physician if they're a member of the County Medical Society, because I think that shows a level of caring and involvement for their patients when the physician is a member. But the County Medical Society is local, like I said, and so the County Medical Society helps see what's going on in our county, takes issues of what's going on in our county, and we bring it to the state level. MedCI, or the Maryland State Medical Society, is made up of component counties in our state. So we are the Montgomery County. We're the largest county in the state, obviously. Mm-hmm. But there's Baltimore County, Anne Arundel County. All the counties have their component medical societies. We all meet together and we discuss issues together in Baltimore at MedCI's headquarters during the Maryland legislative session, and also at a House of Delegates meeting twice a year. So we're there to serve our patients' needs twice a year, and also when we have the legislative session going on, to work with everyone together. And then the State Medical Society brings our county groups together to come up with a plan. And that game plan is, how can we this year or right now help our patients improve their lives? How do we do it on a regulatory level, a legislative level, or even sometimes working with the governor, which is an executive level. So really, it starts local, it goes to the state, and we all work together to make Maryland a better state for patients. And the American Medical Association is our national organization. The State Medical Society, the MedCI, or the Maryland State Medical Society, is a member of that organization as well. So we all work together, and the AMA works on a federal level, but it also helps us and comes up with policy positions that we can use if we agree with them to make life easier, again, for our patients who we serve and the doctors in the state and in the nationwide scale.
So briefly, what does the local medical society view as some of the health issues at this point in time in Montgomery County?
So on a local level, which is really a state level, we are working on, for example, electronic health records. That's something that, and we can talk more about this later on, is a burden to physicians, but it's meant to help. And the idea is that it helps. It would be to help all our patients, because everything would be visible to every physician right away when the patient comes in. It doesn't happen right now. It doesn't work that way. They're closed off. They don't speak to each other. And it's creating more work, and we can talk about that. But we want to make EHR, electronic health records, like they're supposed to be. We're working on funding for Medicaid. That's important for us. We want also...
what is the Medicaid program? Explain that to our viewers.
Medicaid is funding for the underinsured and those who are below poverty level in the state of Maryland. And we want to make sure there's adequate funds in that so that all the people in Maryland can be seen by a physician. And speaking of being seen by a physician, we want all the people in Maryland to make sure they have choices, and they make sure that the insurance networks like Care First or Aetna or Cigna or United Healthcare have adequate networks of physicians. And those networks are updated so people can find a physician in those networks that's close to them. There's no reason why someone in Montgomery County should have to go all the way to Columbia, for example, or Frederick to find a physician. We want to make sure that we have that. We're supporting initiatives to help reduce consumption of sugary beverages and things that are not healthy for patients. We want to continue to make Maryland a less tobacco state, hopefully one day tobacco free, but that's something we always support, those initiatives. And we want to support legislation to help reduce greenhouse gas emissions, so that's very important for us as well. So those are some of the things we're working on. But basically the idea is that the County Medical Society is a group of physicians who want to make life better for patients, like I said, patients in the state of Maryland, and that's what we do.
And are there any particular programs that are currently advocated by the society at a county level or MedCI on a state level?
Yes, well, we talked about funding Medicaid.
Right.
That's one program that we really want to make sure we work with the state legislature and the governor's office to make sure that's funded. We want to improve funding mechanisms for people who have sexually transmitted diseases and treatment programs for people with sexually transmitted diseases. We want to encourage more to help make Maryland a tobacco-free state by encouraging more taxes on tobacco. That's something we support. We want to strengthen maternal mortality review and the recommendation process, things like that. These are issues. And I can proudly say, if we want to go to some of the successes we've had in the most recent past, and this is something that's happened because of the County Medical Society, because And these are things that are initiated with our county on the state level to MedCI, the Maryland State Medical Society. This is very close to me. We became a state that banned tanning beds for those under the age of 18. Tanning beds are very dangerous. As a dermatologist, I know how people who use tanning beds more than 10 to 20 times in a lifetime have a 70% higher chance of getting skin cancer later on in life. That's 7-0.
Wow.
And and when people do it when they're younger, especially under the age of 18, their likelihood of getting skin cancer is even higher because they're going to live a longer life, hopefully. So we really want to cut down on that. We initiated legislation with the help of the State Medical Society, but it started here in our county to ban tanning beds in minors. And last year that we succeeded in that, and the Maryland State Legislature passed that ban. So we're very proud of that. It's another example of where the County Medical Society is trying to make life safer for the people of Maryland. We helped increase, last year we supported legislation, and it also came from the county, I believe, to make tobacco and smoking that you have to be 21 years old to purchase those. It used to be 18. So we redefined lead level guidelines for the state of Maryland. So again, making sure that people in Maryland have less lead-free lives, especially in the homes that we live. So those are some of the issues that we succeeded in. And in the past legislative session, we also succeeded in making prior authorization a little easier for people in the state of Maryland. That prior authorization and something called step therapy is a big issue for us as physicians, and we can talk a little bit more about that later. But basically, it makes life more difficult. When I want to write my patient a prescription, I have to fill out a form to get it approved. And that form can be 1 page or it can be 15 pages. And it's usually denied. And whatever reason I usually say is the reason I want to have that medication for my patient, the insurer just ignores it and says the patient can't have the medication because of X, Y, and Z. But I already said X, Y, and Z is not important or doesn't work for this patient. They just deny it. So we want to make life easier for people to get medicines in our state. And so we're continuing to work on, but we've created making Maryland a much safer state than other states in the country for people to get medications that they want. So that's something we continue to work on. We've had success in the past.
We have 1 minute before we go to the break. So with all this healthcare advocacy for our community, do you meet regularly with our legislators?
We do. That's something the Montgomery County Medical Society is very proud of. We have a legislative breakfast every year before the legislative session starts. And we meet with all of our county legislators who like to come. They come to our office and we discuss the issues that we have, the mutual issues that we have for the upcoming legislative session. So they're aware and they know what we're going to be advocating for. And then also during the legislative session, which in Maryland is just January through April, we meet with the legislators as well. So we meet in their offices in Annapolis. Mm-hmm. So we go down en masse, we bus down together, we drive down together, and we spend 2/3 of a day there in Annapolis talking to our legislators and making sure they know what our issues are and what the bills are that we support, that we would like them to support. And so we're there, and these bills are usually always about helping our patients, like we've talked about. And we go down, we take the time off from our busy offices, take the day off, because it's important. I think it's more important, and the doctors who are with us, who are members of the County Medical Society, also think it's more important. You don't have to work all the time. It's important to get out there and make a difference in our patients' lives by legislation.
Very good, Dr. Green. We're going to pause briefly for a public service announcement. More with Dr. Larry Green, President of the Montgomery County Medical Society. We'll be right back. Can we go back to that closing?
Yeah.
Thanks.
I'll go ahead.
Tell me when you're ready.
Thanks. I hope I didn't go on too much.
Yeah, no worries. Tell me when I just want to go back to the closing.
Whenever you're ready, go ahead.
We can talk more about EHR.
Okay, hold on 1 second. All right. We're going to pause for a public service announcement. More with Dr. Larry Green, President of the Montgomery County Medical Society. We'll be right back.
Once there was a boy who did the same thing again and again. One day, he was told he had autism. He got help and slowly learned how to live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
We're back, and my guest this evening is Dr. Larry Green, President of the Montgomery County Medical Society. Dr. Green, briefly, what is the Flu Busters campaign on behalf of the Medical Society?
So the Flu Busters is one of our signature programs that we do. And it is something that we want to encourage everyone to receive a flu vaccine every year. But a flu buster is someone who encourages not just themselves, I received my vaccine last month, but their staff, their family, their friends to get a vaccine. And that's what our Flu Busters campaign is all about. We think everyone in the county should be vaccinated. We want everyone in the county to be vaccinated because preventing the flu is very important because the flu people can die, unfortunately, of flu. It's very serious. And it's readily preventable with a flu vaccine. So that's basically what the campaign is about, getting everyone to get a flu vaccine. So anyone who's listening, who hasn't received the flu vaccine, I'm suggesting please go get it. It's readily available. If you have trouble finding a place, you can go to our website, montgomerymedicine.org, and we can find a place close to you for you.
Now, some of our viewers will say, well, hold on there, Dr. Green. I thought the flu vaccine was only for little children and for senior citizens, and I'm only 45. What do you say to that viewer? I
say the flu vaccine is for everybody. My children who are 23 and 20, I made sure they got vaccinated. They're healthy young adults. I'm vaccinated. I make sure everyone on my staff who range in age from 23 to 60 are vaccinated. It's for everybody. Everyone should get vaccinated. Even if you're healthy and you get the flu, it's not fun. No one wants to be bedridden for several days. It's preventable. Get the flu vaccine.
Okay. So briefly, let's go on to discuss some of the changing atmosphere now to practice medicine locally and nationally, something you alluded to at the top of the show. What are some of the changes you see hitting the medical landscape locally and nationally?
So the changes we see, it's interesting. So the county does something called a physician survey every year. And we survey physicians about, in our medical society, about what are the issues that they're facing. And we're really the only county in the state that does that. So we get answers. So we really feel like we're on the pulse of what's going on and what our physicians are experiencing. So we talked about EHR, and I'll come back to that in a second, electronic health records.
Okay.
And we'll come back to that in a second. But I do want to talk about one other thing that's happening, and that's the consolidation of physician practices. And that's something the Medical Society is also very concerned about. We have people joining hospitals, becoming big groups. We have people joining large medical systems. We have people joining venture capital groups. And the days of the physician as a solo practitioner or in small group practice are dying. And that's concerning because we want to have lots of people, not small groups. When there's just a few small players, then that never works for people who have to come see the doctor. When you think of businesses, when we get consolidation in the industry, it usually makes it much more difficult for people. And it's the same thing we're worried about happening in medicine. So we're on the pulse of that. We talk to our physicians, and we're educating them about the various choices out there. And we want our physicians to be able to make the best choice and join the type of practice that suits them best. But what this consolidation, one of the reasons physicians give as why this consolidation is happening is because of all the extra regulations and time that us physicians have to spend working on paperwork or computer work as it is now, because we're all using electronic health records. So I mentioned that they don't talk to each other. So that's one thing, because the idea is that it would be very easy that I'll talk to each other. If your patient comes to see me, I'll know everything about that patient before the patient even comes in, because we would know because it's electronic health records are shareable. That doesn't happen. If a patient of yours comes to see me, I don't know anything about that patient because your electronic health records system does not talk to mine. So that's an issue we want to work on, and we're trying to initiate legislation on a state and a federal level to do that. It's very hard to work against big business, which is why they don't talk to each other, because businesses don't want, one business wants to keep all the information to their own because they can spread their information and make profit on that. But we're working on that. But what that does is it increases the burden and paperwork that we have to do. The average doctor these days, and this is according to our practice survey in Montgomery County, spends 2 hours every day after patients leave doing paperwork, computer paperwork, doing prior authorizations, trying to fill out the electronic health record, which is sometimes breaking down or not working appropriately, for our patients. We're out here to serve our patients, but the electronic health record system is right now not working for us, and it's making life more difficult. In fact, the survey shows that we do, it's also contributing significantly to what we call physician burnout. Doctors getting depressed and having to see, sometimes needing psychological help to get through the day, not because we can't do what we were trained to do, what we want to do. We're not spending time helping our patients. We're spending time on paperwork trying to get a medicine for our patients, or trying to get a procedure approved for our patients. That's the problem. We like to go back to the old days before we had computers, but this has nothing to do with computers, where if I think something is best for a patient, the patient would get that immediately. It's not like that. Hours and hours of work, and that is one of the main issues we're working on as well.
So between the stress of getting things pre-authorized with insurance companies and now the escalating time demands of electronic medical records, the time demands on physicians are greater than ever.
Yes, the time demands on physicians are greater than ever, not seeing patients, but outside of patient care.
Extraneous issues.
Extraneous to patient care, and that's not what we want to do.
Did your survey indicate what is the average number of hours physicians are putting in per week, not just with direct patient care, but all the extraneous issues?
I can't say it offhand, Dr. Doman, but I believe it's well above 60 hours a week that we're putting in. And that's not just in patient care, but that's an extra work involved. That's a long week for someone who wants to really just spend time helping their patients. And I think the extraneous patient care is coming up to almost be what our patient time is, and that's really not. It should just be patient time, not extraneous information. So we really want to help our patients, and that again is contributing to physician burnout, and why 61% of Montgomery County physicians in our survey said they were experiencing symptoms of burnout. 61%. Wow. It's a very high percent. Now, the survey also said most of us are very satisfied. We're still satisfied with what we do, and I think that's because we still love taking care of patients, but the regulations make it very difficult.
Yeah. So if 61% of our colleagues have some symptoms of burnout, what are they utilizing to deal with that?
Well, that's up to the individual physician. But the county started in 2016 a charity that one of the things that we do in that charity is trying to help. We provide free counseling that is completely anonymous for physicians who are experiencing the symptoms of burnout. And our charity, we contribute to that charity for people who want to go and receive counseling. And that's completely, like I said, anonymous. That's one thing that we as a county medical society can do. So we have this program that we try and do, and that's one thing we can do in that. And then, of course, on an advocacy level, where we talked about this, we're always going to the state and even on a federal level to advocate for lessening of regulations and burden, so we can get back to what we want to do, is help our patients.
Do you find that many physicians are considering early retirement because of the burnout?
Physicians consider early retirement. It's one of the reasons for consolidation. It doesn't really joining a large group doesn't really help reduce the prior authorization, but then you have to deal with being a small businessman in terms of managing personnel or billing, which we all have to do. So it eliminates some of that, and I think that's one of the reasons why we have consolidation. But the County Medical Society our goal is to make life easier for the doctors so we can do what we do best. Right. So whatever way that is. So whether we can provide counseling through our charitable organization, the National Capital Physicians Association, or through advocacy.
Let's go on to some other societal health issues that our viewers, of course, are concerned about. We hear a lot about the opioid crisis. What is the county and state society assisting to deal with those issues? So we work with the State Medical Society, as well as the governor, as well as the Board of Physicians, and pretty much all the stakeholders in the state and on a federal level as well on the opioid crisis. It's a national crisis that is certainly present in Montgomery County. Very serious. We are part of the State Medical Society's 4-year task force on ways to help alleviate the opioid crisis. We work closely with the Board of Physicians and the State Medical Society and the state legislature, as well as the governor, to get the PDNP in place, the Prescription Drug Monitoring Program. We are a state that has a
prescription drug monitoring program, PDMP, whereas that's something where every opioid prescription written has to be entered into this.
Into a database.
Into a database. And before I can prescribe an opioid for a patient, I am required to see what they've received from that database. So I know it won't work for me unless I see what the patient's received, and what I input is also put in there, so everyone knows how much every other patient has in terms of opioids. It's almost like the ideal electronic health record, in a way, where everyone's talking to everyone, and we have all the answers. Mm-hmm. So we have that in the state of Maryland with the PDMP, the Prescription Drug Monitoring Program for opioids. That we succeeded, and that's something we're very proud of having. And we work with the governor as well, on any program he has. So it's some of the things we are doing to alleviate the opioid crisis.
What about gun violence? Is that something where the county or state societies have taken a position?
Gun violence is something, unfortunately, that really is sadly affecting everyone in our society in the 21st century. And the County Medical Society works with other organizations like the State Medical Society, MedCai, as well as the American Medical Association. And we support the positions that these organizations have taken. And I'm pretty sure, and don't hold me to this, but all of us are supporting banning of automatic weapons. I know that's come up in our County Medical Society board meetings and something that the County Medical Society supports, but we're working in conjunction with the state as well as our national organization on this issue. It's a national problem in the United States.
Mm-hmm. Medical marijuana now has become a hot topic locally and nationally. Has the society taken any positions on medical marijuana?
The society wants to make sure medical marijuana is dispensed fairly to patients who want it and for patients who really need it. So while we don't have an exact position on medical marijuana, we support medical marijuana as we have in the state right now, but we want to make sure there are safeguards and that our patients are receiving the type of medical marijuana that we want them to receive, and not changing the allotments or prescription of it, the amount of THC percent. It's something we want to make sure that patients are getting the right thing for their condition to help alleviate it.
Okay. Dr. Green, our time is up. If our viewers have any questions, how can they reach you?
They can reach me by contacting the County Medical Society. The first way is in the website, montgomerymedicine.org, and also our phone number, 301-921-4300. And we're here to help you, and people in Montgomery County are welcome to call the County Medical Society. We're not just physicians, because we're here for them as well. It's physicians in the county helping our patients. That's what we're about.
Dr. Green, thank you for joining us on Housecall.
Thank you very much. Glad to be here, Dr. Doman.
My thanks to Dr. Lawrence Green, President of the Montgomery County Medical Society, for a very informative interview. My thanks to my team here at the studio, and most important, thanks to you at home for welcoming us into your home. Tell us how we're doing. You can reach me at my practice website, montgomerygastro.com. As for our next show, it's going to be fascinating. I'll be inviting the Secretary of Health of the state of Maryland to discuss the statewide and national vaping epidemic. See you then next time for another edition of Housecall. Good evening.